51. Which symptom is most concerning in a patient with PAD? A. Hair loss on legs. B. Dependent rubor. C. Intermittent claudication. D. Gangrene. Answer: D. Gangrene. Rationale: gangrene D. suggests tissue death from severe ischemia requiring immediate intervention. Hair loss A. Rubor B. and claudication C. indicate progressive but not life-threatening PAD. 52. Which statement by a patient with PAD indicates proper foot care? A. I will check my feet weekly. B. I will wear tight socks to keep my feet warm. C. I will keep my feet moisturized but avoid applying lotion between my toes. D. I will soak my feet in warm water daily. Answer: C. I will keep my feet moisturized but avoid applying lotion between my toes. Rationale: moisturizing C. prevents cracking, but avoiding lotion between toes prevents fungal infections. Checking feet weekly A. is not frequent enough. Tight socks B. restrict circulation. Soaking feet D. increases infection risk. 53. A PAD patient is prescribed aspirin. What is the purpose of this medication? A. reduce cholesterol levels. B. prevent blood clots. C. increase circulation. D. treat leg pain. Answer: B. prevent blood clots. Rationale: aspirin B is an antiplatelet agent, reducing thrombosis risk. It does not lower cholesterol A. increase circulation C. or treat pain D. directly. 54. Which intervention is most important after angioplasty for PAD? A. encourage ambulation immediately. B. monitor pedal pulses frequently. C. keep the patient in a high Fowler's position. D. apply heat to the affected limb. Answer: B. monitor pedal pulses frequently. Rationale: checking pedal pulses B. ensures blood flow is restored after angioplasty. Early ambulation A. should be done cautiously. High Fowler's position C. may reduce perfusion. Heat D. can cause burns due to decreased sensation. 55. A nurse is teaching a PAD patient about dietary modifications. Which food should be avoided? A. skinless chicken. B. salmon. C. whole grains. D. fried foods. Answer: D. fried foods. Rationale: fried foods D. are high in saturated fats, worsening atherosclerosis. Skinless chicken A. salmon B. and whole grains C. are heart-healthy choices. 56. What is the best sleeping position for a patient with PAD? A. elevate the legs. B. lie flat. C. sleep with legs hanging off the bed. D. sleep with a heating pad on legs. Answer: C. sleep with legs hanging off the bed. Rationale: dangling legs C. improves arterial circulation in PAD. Elevating legs A. worsens ischemia. Lying flat B. does not optimize blood flow. Heating pads D. increase burn risk. 57. A nurse suspects acute limb ischemia. What is the priority intervention? A. apply compression stockings. B. administer forheparin. C. encourage ambulation. D. elevate the limb. Answer: B. administer forheparin. Rationale: forheparin B. prevents clot progression in acute ischemia. Compression stockings A. worsen arterial occlusion. Ambulation C. is contraindicated. Elevation D. reduces blood flow. 58. Which symptom is characteristic of intermittent claudication? A. sudden, severe pain at rest. B. aching or cramping with exercise that resolves with rest. C. cold, numb feet. D. leg swelling and redness. Answer: B. aching or cramping with exercise that resolves with rest. Rationale: intermittent claudication B. is characterized by muscle pain, aching or cramping triggered by activity and relieved by rest. Rest pain A. and numbness C. suggests severe PAD. Swelling and redness D. are more associated with venous disease. 59. In addition to medication, What is a key lifestyle modification for managing PAD? A. Drinking more water. B. Smoking cessation. C. Reducing carbohydrate intake. D. Limiting fluid intake. Answer: B. Smoking cessation. Rationale: smoking cessation, B, is the most important lifestyle change to slow PAD progression. It directly affects arterial health. The other options do not directly impact the progression of PAD. 60. What is the expected outcome of treatment for mild PAD? A. Improved rest pain. B. Increased wound healing. C. Relieved intermittent claudication with exercise. D. Increased dependency on pain medication. Answer: C. Relieved intermittent claudication with exercise. Rationale: in mild PAD, exercise often improves intermittent claudication by increasing circulation. Rest pain, A, suggests severe disease and wound healing, B, is more related to severe cases. Pain medication dependency, D, is not desired. 61. Which of the following is a common extrahepatic manifestation of PAD? A. Fatigue. B. Erectile dysfunction. C. Weight loss. D. Jaundice. Answer: B. Erectile dysfunction. Rationale: erectile dysfunction, B, is a known extrahepatic manifestation of PAD due to reduced blood flow. Fatigue, A, and weight loss, C, can occur but are not specific to PAD. Jaundice, D, is related to liver diseases, not PAD. 62. Which of the following is not a common risk factor for PAD? A. Age greater than 60 years. B. Hyperlipidemia. C. Low blood pressure. D. Diabetes mellitus. Answer: C. Low blood pressure. Rationale: low blood pressure, C, is not a risk factor for PAD. Rather, hypertension is. The other options, age, hyperlipidemia, diabetes, are well-established risk factors for PAD. 63. A patient with PAD and severe claudication is scheduled for a vascular surgery. What is the primary goal of surgery? A. Relieve pain at rest. B. Improve blood circulation to the affected limb. C. Prevent infection. D. Reduce blood pressure. Answer: B. Improve blood circulation to the affected limb. Rationale: the primary goal of vascular surgery is to restore circulation and alleviate claudication. Pain relief at rest, A, is a sign of severe PAD, and infection prevention, C, is important but not the primary goal. Blood pressure reduction, D, is not directly addressed by surgery. 64. What is the role of peripheral arterial bypass surgery in the management of PAD? A. To remove blood clots. B. To restore blood flow to affected tissues. C. To treat infection in the legs. D. To decrease cholesterol levels. Answer: B. To restore blood flow to affected tissues. Rationale: peripheral arterial bypass surgery, B, involves rerouting blood flow to restore circulation to ischemic tissues. Clot removal, A, is not the primary purpose. Infection treatment, C, and cholesterol management, D, are secondary concerns. 65. Which dietary modification is recommended for a patient with PAD? A. Increase sodium intake. B. Increase fiber and omega-3 fatty acids. C. Decrease protein intake. D. Increase saturated fat intake. Answer: B. Increase fiber and omega-3 fatty acids. Rationale: a heart-healthy diet with fiber, B, and omega-3 fatty acids helps manage cholesterol levels and vascular health. Sodium, A, and saturated fat, D, should be limited. Protein, C, intake should be adequate but not excessively high. 66. What is the priority assessment for a patient after a peripheral angioplasty? A. Monitor urine output. B. Check for signs of infection. C. Assess for signs of bleeding or hematoma. D. Evaluate oxygen saturation levels. Answer: C. Assess for signs of bleeding or hematoma. Rationale: after angioplasty, C, monitoring for bleeding or hematoma at the insertion site is critical. Urine output, A, infection, B, and oxygen levels, D, are also important but less immediate post-procedure priorities. 67. What does a decrease in the ankle brachial index, ABI, indicate in PAD patients? A. Improved circulation. B. Decreased blood flow to the legs. C. Increased blood pressure. D. High cholesterol levels. Answer. B. Decreased blood flow to the legs. Rationale. A. Decreased ABI, B. indicates reduced arterial blood flow and is a sign of PAD. An improved ABI, A. suggests better circulation, high cholesterol, D. is not directly measured by ABI, and blood pressure, C. is unrelated to ABI. 68. A PAD patient is at high risk for developing what type of complication? A. Myocardial infarction. B. Pulmonary embolism. C. Stroke. D. Gastrointestinal bleeding. Answer. A. Myocardial infarction. Rationale. PAD patients, A. are at increased risk for cardiovascular events like myocardial infarction due to atherosclerosis, while stroke, C. is a risk, MIA is more directly related to PAD. Pulmonary embolism, B. and gastrointestinal bleeding, D. are less common in PAD patients. 69. Which patient teaching point is most important for someone with PAD? A. Exercise to the point of fatigue. B. Wear tight clothing to prevent leg swelling. C. Do not elevate your legs during rest. D. Inspect your feet regularly for signs of infection or injury. Answer. D. Inspect your feet regularly for signs of infection or injury. Rationale. Foot inspection, D. is crucial to prevent infection or ulcer formation due to impaired circulation in PAD. Exercise to fatigue, A. can worsen symptoms, and tight clothing, B. is harmful to circulation. Leg elevation, C. may exacerbate symptoms. 70. In PAD, which of the following is most commonly seen on physical examination? A. Cool, pale skin on the affected limb. B. Warm, flushed skin. C. Red, swollen feet. D. Increased hair growth on the legs. Answer. A. Cool, pale skin on the affected limb. Rationale. Cool, pale skin, A. is a typical finding in PAD due to decreased blood flow. Warm, flushed skin, B. is seen in venous insufficiency, swelling, C. suggests venous disease and increased hair growth, D. is uncommon in PAD. 71. A patient with PAD is prescribed statins. What is the primary purpose of this medication? A. To increase circulation. B. To lower cholesterol levels. C. To relieve pain from claudication. D. To prevent blood clots. Answer. B. To lower cholesterol levels. Rationale. Statins, B. are used to lower cholesterol and reduce atherosclerosis, which contributes to PAD progression. They do not directly affect pain, C. or circulation, A. nor do they act as anticoagulants, D. 72. What is a potential complication of untreated critical limb ischemia in PAD patients? A. Increased ability to exercise. B. Gangrene and tissue loss. C. Improved wound healing. D. Spontaneous limb regeneration. Answer. B. Gangrene and tissue loss. Rationale. Critical limb ischemia, B. leads to gangrene and tissue death due to severe lack of blood flow. Improved exercise ability, A. and wound healing, C. are less likely, and limb regeneration, D. does not occur. 73. Which patient is at greatest risk for developing PAD? A. A 55-year-old female with a family history of hypertension. B. A 70-year-old male with type 2 diabetes and a smoking history. C. A 40-year-old female with a sedentary lifestyle. D. A 65-year-old male with high cholesterol but no other risk factors. Answer. B. A 70-year-old male with type 2 diabetes and a smoking history. Rationale. Older age, B. diabetes, and smoking are all significant risk factors for PAD. The other options lack one or more of these high-risk factors. 74. Which diagnostic test is used to evaluate blood flow in patients with PAD? A. Chest X-ray. B. CT angiography. C. Blood glucose levels. D. Complete blood count. Answer: B. CT angiography. Rationale: CT angiography, B, provides detailed images of blood vessels to assess PAD. Chest X-ray, A, and blood tests, C, D, are not used to evaluate PAD directly. 75. The ankle brachial index, ABI, is used to assess A. Heart function. B. Blood pressure control. C. Blood flow to the limbs. D. Fluid balance. Answer: C. Blood flow to the limbs. Rationale: the ABI-C measures the ratio of blood pressure in the ankle compared to the arm, providing an indicator of blood flow and PAD. Heart function, A, and fluid balance, D, are not assessed with the ABI. 76. The primary benefit of antiplatelet therapy in PAD is A. To reduce cholesterol levels. B. To prevent blood clots. C. To lower blood pressure. D. To relieve leg pain. Answer: B. To prevent blood clots. Rationale: antiplatelet therapy, B, prevents clot formation, which can cause complications in PAD patients. It does not directly lower cholesterol, A, blood pressure, C, or relieve pain, D. 77. A patient with PAD is considering surgery. Which complication should be discussed with the patient? A. Skin discoloration. B. Nerve damage. C. Increased hair growth. D. Reduced blood pressure. Answer: B. Nerve damage. Rationale: nerve damage, B, is a potential complication of surgical intervention. The other options are less likely to occur. 78. A nurse is educating a PAD patient about self-care. What advice is most important? A. Limit your physical activity. B. Wear tight socks to prevent swelling. C. Avoid crossing your legs for extended periods. D. Take aspirin to relieve pain. Answer: C. Avoid crossing your legs for extended periods. Rationale: crossing the legs can impede circulation in PAD patients. The other options are not recommended for PAD management. 79. What does the presence of rest pain in a PAD patient indicate? A. Mild disease. B. Severe ischemia. C. Compartment syndrome. D. Improved blood flow. Answer: B. Severe ischemia. Rationale: rest pain, B, is a sign of severe ischemia due to lack of blood supply. It is typically seen in advanced PAD. Mild disease, A, presents with claudication, not rest pain. 80. Which vascular procedure can help treat PAD by restoring blood flow? A. Hemodialysis. B. Peripheral angioplasty. C. Carotid endarterectomy. D. Bypass surgery. Answer: B. Peripheral angioplasty. Rationale: peripheral angioplasty, B, involves opening narrowed arteries in the legs to improve circulation. Hemodialysis, A, is used for kidney failure, and carotid endarterectomy, C, addresses carotid artery stenosis. Bypass surgery, D, is another option for restoring blood flow in severe cases. 81. What is the most common cause of peripheral artery disease, PAD? A. Atherosclerosis. B. Vasculitis. C. Deep vein thrombosis. D. Diabetes mellitus. Answer: A. Atherosclerosis. Rationale: atherosclerosis is the primary cause of PAD, characterized by plaque buildup in arteries. Vasculitis is an inflammatory condition, DVT affects veins, and diabetes is a risk factor, but not a direct cause. 82. Which symptom is most characteristic of PAD? A. Leg swelling. B. Intermittent claudication. C. Red, warm skin. D. Numbness in both arms. Answer: B. Intermittent claudication. Rationale: intermittent claudication, pain triggered by activity and relieved by rest, is a hallmark of PAD. Leg swelling is more common in venous diseases, and red, warm skin is associated with infections. 83. Which test is most commonly used to diagnose PAD? A. Ankle brachial index, ABI. B. Chest X-ray. C. Electrocardiogram, ECG. D. Pulmonary function test. Answer. A. Ankle brachial index, ABI. Rationale. The ABI compares blood pressure in the ankle and arm, identifying arterial insufficiency. A chest X-ray and ECG assess the heart, while pulmonary function tests evaluate lung function. 84. Which of the following is a modifiable risk factor for PAD? A. Age over 60. B. Smoking. C. Family history. D. Male gender. Answer. B. Smoking. Rationale. Smoking damages blood vessels, significantly increasing PAD risk. Age, family history, and male gender are non-modifiable risk factors. 85. A patient with PAD reports pain in the lower legs while walking, relieved by rest. What is this symptom called? A. Rest pain. B. Ischemic ulcer. C. Intermittent claudication.
D. Neuropathic pain.
Answer. C. Intermittent claudication. Rationale. Intermittent claudication is a hallmark of PAD, occurring due to inadequate blood flow to muscles during exertion. Rest pain suggests advanced disease. 86. What is the primary goal of treatment for PAD? A. Increase blood flow to the extremities. B. Reduce venous pressure. C. Improve renal function. D. Strengthen heart contractions. Answer. A. Increase blood flow to the extremities. Rationale. PAD treatment focuses on improving circulation to reduce symptoms and prevent complications. Venous pressure is not directly related, and heart function is not the primary concern. 87. Which lifestyle modification is most beneficial for patients with PAD? A. Weightlifting. B. Regular walking. C. High-protein diet. D. Avoiding carbohydrates. Answer. B. Regular walking. Rationale. Supervised exercise therapy, particularly walking, improves circulation and reduces symptoms. Weightlifting is not as effective, and diet modifications alone are insufficient. 88. Which medication is commonly prescribed to reduce the risk of cardiovascular events in PAD patients? A. Warfarin. B. Clopidogrel.
C. Digoxin.
D. Albuterol. Answer. B. Clopidogrel. Rationale. Clopidogrel is an antiplatelet drug that helps prevent clot formation, reducing cardiovascular risk. Warfarin is an anticoagulant, digoxin treats heart failure, and albuterol is a bronchodilator. 89. What is a common complication of untreated PAD? A. Deep vein thrombosis. B. Myocardial infarction. C. Critical limb ischemia. D. Pneumothorax. Answer. C. Critical limb ischemia. Rationale. Critical limb ischemia occurs when blood flow to the limbs is severely reduced, leading to ulcers, gangrene, and amputation risk. DVT and pneumothorax are unrelated. 90. Which diagnostic imaging test is useful for visualizing arterial blockages in PAD? A. Doppler ultrasound. B. Colonoscopy. C. Spirometry. D. Mammography. Answer. A. Doppler ultrasound. Rationale. Doppler ultrasound assesses blood flow in arteries, detecting blockages. The other tests are unrelated to vascular assessment. 91. Which of the following is a non-modifiable risk factor for PAD? A. Hypertension. B. Hyperlipidemia.
C. Family history.
D. Smoking. Answer. C. Family history. Rationale. Family history is a non-modifiable risk factor. The other options are modifiable through lifestyle changes and medications. 92. Which symptom suggests severe PAD requiring urgent intervention? A. Cold feet at night. B. Intermittent claudication. C. Non-healing ulcer on the foot. D. Mild leg cramping after exercise. Answer. C. Non-healing ulcer on the foot. Rationale. A non-healing ulcer indicates critical limb ischemia, a severe PAD complication that can lead to gangrene and amputation. 93. Which lifestyle change is most effective in reducing PAD progression? A. Reducing carbohydrate intake. B. Smoking cessation. C. Drinking more water. D. Increasing dairy consumption. Answer: B. Smoking cessation. Rationale: smoking damages blood vessels and accelerates atherosclerosis, making smoking cessation the most effective way to slow PAD progression. 94. Which medication is commonly used to relieve intermittent claudication symptoms in PAD patients? A. Cilostazol. B. Ibuprofen. C. Albuterol. D. Hydrochlorothiazide. Answer: A. Cilostazol. Rationale: cilostazol improves walking distance in PAD patients by promoting vasodilation. Ibuprofen is for pain relief, albuterol is a bronchodilator, and hydrochlorothiazide is a diuretic. 95. What is the primary reason for performing an ankle brachial index (ABI) test? A. To detect venous insufficiency. B. To assess arterial perfusion in the legs. C. To evaluate lung function. D. To measure kidney function. Answer: B. To assess arterial perfusion in the legs. Rationale: the ABI test measures the ratio of ankle to brachial blood pressure, helping diagnose PAD by assessing arterial perfusion. 96. Which PAD symptom differentiates it from chronic venous insufficiency? A. Leg pain worsens with elevation. B. Swollen ankles. C. Varicose veins. D. Brown skin discoloration on the legs. Answer: A. Leg pain worsens with elevation. Rationale: PAD-related ischemic pain worsens with elevation due to decreased arterial blood flow. The other symptoms are characteristic of venous insufficiency. 97. What is a hallmark sign of critical limb ischemia in PAD patients? A. Intermittent claudication. B. Leg cramping after exercise. C. Rest pain and tissue necrosis. D. Increased hair growth on legs. Answer: C. Rest pain and tissue necrosis. Rationale: critical limb ischemia involves severe reduced blood flow, leading to pain at rest and tissue death, gangrene. 98. A patient with PAD is prescribed an antiplatelet drug. What is the primary purpose of this medication? A. To reduce blood clot formation. B. To decrease inflammation in the arteries. C. To lower cholesterol levels.
D. To relieve pain.
Answer: A. To reduce blood clot formation. Rationale: antiplatelet drugs like aspirin and clopidogrel prevent platelet aggregation, reducing clot formation and improving blood flow in PAD. 99. A nurse is educating a patient on foot care for PAD. Which statement requires further teaching? A. I should keep my feet warm and dry. B. I should check my feet daily for sores or cuts. C. I should soak my feet in warm water daily. D. I should wear properly fitted shoes. Answer: C. I should soak my feet in warm water daily. Rationale: patients with PAD should avoid soaking feet due to the risk of maceration and infection. Keeping feet dry and checking for injuries is essential. 100. Which surgical procedure is commonly performed for severe PAD to restore blood flow? A. Coronary artery bypass. B. Carotid endarterectomy. C. Peripheral artery bypass. D. Hip replacement. Answer: C. Peripheral artery bypass. Rationale: peripheral artery bypass surgery restores blood flow in severely blocked arteries. Coronary bypass is for heart disease, and carotid endarterectomy is for carotid artery disease.